Hope everyone's enjoying themselves. So I'll be carrying on the sharing for the effects of shoulder protraction and retraction on upper limb neurodynamic testing. Okay, next. Okay, so maybe I'll share a bit more about myself first. So I graduated same with Jared and the rest of the residents from Physio SIT as well as TCD. So fun fact for myself is actually started working at Heartland since I was in year 2 physio. So I started as a sport massage therapist as well as a personal trainer then. Yeah, and I feel that having that prior experience actually helped to build up my skill sets as well, especially for manual handling. So currently I'm in Somerset as well as Upper Serangoon branch and enrolled in the residency program. Also in the clinic, I also hold a concurrent appointment as the business management officer, where I run a bit more of the marketing side of things. So I'm not sure whether you guys follow the Heartland Rehab IG. If not, you all can follow us as well. Yeah. Okay. Interest-wise, I enjoy seeing more of a gym-related injuries, as well as anything more post-operative knees as well. Yeah. Interest, I like to gym, eat and travel, and the fun fact is that I have actually big hands. So yesterday I went to, you can see the picture over there, I went to measure my hands, it's about 20 cm. Yeah. Okay, next. Okay, so this is the scope of the sharing. Next. Okay, background-wise, so I'm going to present my final year honours thesis, and this was actually presented in the 1310 Pacific Conference in Chiang Mai, 23rd to 24th November. Yeah. So as part of the so together with my coursemate at the time, Walter, as well as Associate Professor Benjamin Soon, we actually came out with this whole poster as well. Yeah. So background-wise, actually when I went to the conference, also managed to meet different physios from various countries, and I think that's a good opportunity to understand how other country physios practice, as well as how they implement research. Yeah, so I think that's a bonus of doing research, where after you finish the research, you can actually present at various conferences and learn from it. Introduction-wise, so my topic is more of ULT. So ULT is actually like a clinical tool used to identify more of a mechanical sensitivity in the upper limb. And you can see the picture, there's ULT 1, 2A, 2B, and 3, mainly to target more of the median, radial, and ulnar nerve. And why the shoulder position matters is actually there's some studies that show that shoulder depression actually affects the way how ULT is being tested, but none of the study actually compared protraction and retraction. Yeah. So therefore, there's a research in this. So coming to the objective, so this pilot study aims to determine how shoulder positioning, protraction, neutral, and retraction affects upper limb neurodynamic testing. Okay. Yeah. So the hypothesis is also that shoulder retraction may reduce mechanical sensitivity compared to protraction and neutral positions. In terms of the methodology, subjects-wise, we actually recruited 36 healthy participants, equal number of males and females, and the inclusion and exclusion criteria is as per above. For the study design-wise, it's actually a cross-sectional design where each participant performed ULT in 3 positions: protraction, neutral, and retraction. And we actually tape the shoulder using rigid tape for it to sustain that position. Yeah. In terms of the results-wise, we found that, you can also see the diagram there, for the asterisk, it refers to P less than 0.05 or more of a significant result. So for ULT 1 and 2A, for the median nerve, there are actually significant differences whether it's from neutral to retracted or neutral to protracted. Whereas for 2B, the only difference is from protracted to retracted. And lastly, for ULT 3 ulnar nerve, there's no significant differences found at all. Yep. So discussion-wise, based on the findings, we actually found that shoulder retraction reduces mechanical sensitivity for median nerve and radial nerve, as shown in the results as above. So in terms of the clinical implication, it could also suggest that when we train patients in a more retracted position, for example, doing exercises such as horizontal bended rows, it perhaps could also reduce the mechanical sensitivity of the nerve. Yeah. And there's also, in terms of the research-wise, most of it actually talks about how when you displace the shoulder, the humeral head more backwards, actually have to open up more of the brachial plexus, which could potentially explain the results as well. Next. Okay. In terms of the limitation-wise, because we're also doing it in a more asymptomatic population, as well as the population size is quite small, So I wouldn't generalize this data to the general public per se, and hence further research needs to be done in this area. And also to follow up, I'll also be working with Prof. Ben to see how we can improve this pilot study and take this study to expand to a larger population. Okay, thank you everyone for your attention.
Thank you. Okay, now it's time for question and answer. Don't worry, I cannot let you off yet. So I have to once again throw it to the crowd for any question and answer. Any questions? They are very nice to you, you know. That's right.
Any questions can ask me later.
Yeah, they are like, no, it's okay, let him rest. They give me that face. Over here, anyone? Any questions at all? Boss? You want to tekan or not? Very good, really.
Okay.
Okay, well done! Give him another big round of applause. Okay.